Now we'll talk about treatment of some blood related issues. That's in pharmacology. And serum coming. We're trying to look at bleeding disorders. Okay. And we'll look at a category of drugs known as fibrinolytics. Then we'll also look at treatment of anemia. Note that we are just listing the drugs and passing. We'll come back later and discuss them very well. Okay. So bleeding disorders, let's go one by one. So we have different types of bleeding disorders, and it's just a condition where blood is not clotting properly. Do you understand? So it depends on the specific disorder. Do you understand? So it depends on the causes. So blood could not be clotting well simply because what do they call it? Simply because clotting factors are missing. So if clotting factors are missing, you can easily replace the one that is missing. It could be factor 8, it could be factor 9. Then we have other drugs like the Desmopressin, which stimulate the release of Willebrand factor and factor 8. That's when you're having all those hemophilia A of Willebrand disease. Okay, that one, okay, release of Willebrand factor. Then we have antifibrinolytic agents like the Tranexamic acid and aminocaproic acid. They stabilize clots. We have supportive cares like blood transfusion, iron supplementation. That's if the bleeding is so chronic. Then we have emerging therapies like gene therapy is going on. Okay, this one is aiming at if you have an issue, they basically just identify the gene mutated and handle it, mostly for inherited issues. The fibrinolytics in general are just drugs that dissolve blood clots. So that one are mainly used for if the clotting is too much. So you now give a drug to be breaking it down. Okay, lytic is what? Breaking it down. So we have drugs like the Alteplase, we have the Reteplase, we have the Tranexamic, we have the streptokinase, we have the urokinase. So they are used when you have all those acute ischemic stroke, also acute myocardial infarction, or massive pulmonary embolism. So risk factors, they can tilt you from trying to repair the abnormal clotting that is too much to making you bleed. Do you understand? Then for the pharmacological approach to anemia, you are trying to treat based on the underlying cause. So it could be iron deficiency anemia, so you replace oral iron or intravenous iron. It could be vitamin B12 deficiency, you replace it with vitamin B9, you replace by folic acid. Then also you can have anemia of chronic disease, where you basically give drugs that will stimulate more blood production. Then also iron supplementation often required alongside it. Then we have hemolytic anemia, where it's more of like the blood is being broken down. Okay, so corticosteroids can work, or sometimes you go for surgeries like splenectomy. Always back it up with blood transfusion. So all these drugs we listed here, we'll be coming back later on to talk about their pharmacology, okay, in a bit.